Once you turn 50 years old, you enter this critical time in your life where just a few decisions you make about your health will have a huge impact on how successful you'll age over the next several and hopefully many more decades. So in this video, I want to discuss the critical mistakes I see people making over and over again, and mistakes that will unfortunately lead to issues like heart attacks and strokes and dementia and even many cancers. You know, I used to take care of acutely ill patients in the hospital where many folks are coming in very sick with conditions that are completely preventable, but unfortunately too late to reverse at that point. So if you're in your 50s or even your 40s, now is the time to correct these mistakes before it's too late. And what I'll talk about is nutrients and supplements that are often promoted as healthy, but you will need to avoid. And then I'll talk about evidence-based supplements that most people need to incorporate into the regimen. And I'll also talk about important steps that you need to take to reverse chronic disease and slow down aging. And at the end of the video, I'll talk about an important blood test that you need to check that is absolutely vital in prevention of heart disease. But it's a test that most doctors don't check or even know about. Hi, I'm Dr. Leonid Kim. I am board certified in obesity and internal medicine. And on this channel, I go over the most up-to-date and evidence-based information on the topics of weight loss, metabolic health, and longevity. Let's get into it. So let's start with the things you need to avoid. First up is you need to be careful with high doses of vitamin D. Now, vitamin D is very important for our health, but more is not always better. And we have randomized controlled trials that have shown that high doses of vitamin D resulted in an increased risk of falls and fractures, as well as an increased risk of kidney stones if excess vitamin D is taken with calcium. Now, having said that, I think proper stores of vitamin D are essential for good health and aging, especially when it comes to inflammation and autoimmune conditions, and even cancer prevention. And there are some studies that show that up to 40% of US population is deficient in vitamin D. Now, unfortunately, the most recent guidelines from the Endocrine Society have been very unhelpful in giving us useful guidelines on proper targets for vitamin D levels. And what's worse is the guidelines even discourage testing vitamin D levels in adults under 75 years old, or adults without risk factors for deficiency. But I do think it's still very important to regularly check your vitamin D levels to make sure they're not too low or too high, especially if you're taking high doses, so doses higher than 2,000 international units per day. And by the way, some people require even more aggressive dosing, especially when it comes to autoimmune conditions or cancer prevention or dementia prevention. And I'm planning on making a video on that in the future, so stay tuned for that. Next, another supplement that you should not overconsume is iron. I see it all the time in my patients who take iron for fatigue or low energy. And yes, iron can be helpful if the fatigue is related to iron deficiency anemia, but high levels of iron can build up in your organs and it can damage your heart and your liver and your pancreas. And high doses of iron can also deplete your zinc levels. And zinc is essential for your proper immune function and skin health and inflammation. So instead of taking iron supplements, I would just try to make sure you get your iron from natural whole foods like red meat and shellfish and legumes like beans and lentils and chickpeas. Next, I would take a look at your daily multivitamin to make sure you're not taking in too much vitamin A, as high doses of vitamin A have been linked to liver damage and poor bone health, and it can also cause skin problems. So instead of taking vitamin A in supplement form, I would encourage you to try to get it from natural foods. So you want to eat foods like fatty fish, like salmon or tuna, or you can get it from vegetables like sweet potatoes, or fruits like mangoes or watermelon. Now, let's switch gears and let's talk about supplements that most people are missing and they should probably incorporate into their regimen. First up is one of my favorite supplements, and it's psyllium husk. And it's probably one of the most underrated supplements that does wonders for your health. Psyllium husk has been shown to lower your cholesterol and improve your blood sugar control, and it's vital for your optimal gut health. So there was a large meta-analysis published in the Lancet Journal in 2019 that looked at more than 200 studies and included over 4,600 participants. And that study showed that high fiber intake compared to low fiber intake was correlated with a 15 to 30% decrease in all-cause mortality and cardiovascular related mortality. It also showed a decrease in heart attacks and strokes and type 2 diabetes and colorectal cancer. And when it comes to psyllium husk specifically, a recent systematic review and meta-analysis of 61 randomized controlled trials showed that psyllium improved insulin resistance, it improves systolic blood pressure and blood sugar and LDL cholesterol. And another benefit, psyllium husk is a prebiotic, meaning it's a fiber that feeds the beneficial gut bacteria. So it promotes gut health, and it has has downstream benefits on heart health and reduced inflammation. Now, the next supplement that most people are missing that you need to discuss with your doctor is magnesium. And it's estimated that 45% of US population is deficient in magnesium. And magnesium is an extremely important enzyme that helps us maintain strong bones, and it's important for heart health and metabolism and for sleep. And magnesium also has anti-aging properties, and it's important in cancer prevention. And another important reason to maintain adequate magnesium levels is dementia prevention. And just like with heart disease, dementia prevention starts in our 50s or even in our 40s, and magnesium plays a huge part of it. So there was an observational study of over 6,000 people ages 40 to 73 that show that high dietary magnesium intake of about 550 milligrams per day correlated with larger gray matter and larger hippocampus volume when compared to a lower average intake of magnesium of about 350 milligrams. And that difference in brain health was particularly evident in women. So for an average 55-year-old in the study, the increase in brain volume translated roughly to 1 year of reduced brain aging. And there was another study that followed more than 1,000 adults for 17 years that found that those that consume at least 196 milligrams of magnesium were 37% less likely to develop dementia in old age. Now with magnesium, you also have to be sure to take the right form of magnesium, as there's many different options like magnesium glycinate or taurate, or magnesium oxide, or L-threonate. So if you'd like to learn more, I made a separate video about how to choose the right magnesium for you, and I'll post a link to the video in the description below. Now, beyond supplements, one of the most important factors that will determine how gracefully you'll transition into older age is your sleep. The quality of your sleep has a direct effect on all the chronic diseases that plague us today, like heart disease and strokes and diabetes and even cancer. Now, as we age, sleep quality usually declines, and people over the age of 50 do not get as much restorative sleep or therapeutic sleep. And reduced sleep is very strongly associated with memory impairments and increased risk of neurodegenerative diseases like Alzheimer's. And poor sleep also weakens your immune system, and our immune system is important not only for fighting infections, but it's also our first line defense against cancers. And not to mention the metabolic issues that result from disruptive sleep, which eventually lead to weight gain and diabetes and heart disease and high blood pressure and strokes. So it's especially important to identify the causes of poor sleep and fix your sleep before it's too late. So the framework to fix your sleep that I usually give to my patients is something I borrow from Matthew Walker's book, Why We Sleep. First, it's important to stick to a sleep schedule, meaning we need to try to go to bed and wake up at the same time each day. Next, we need to avoid caffeine at least 8 to 10 hours before bedtime. Many people drink caffeine way too late in the day, and even though that caffeine may not prevent you from falling asleep, it still disrupts the quality of your sleep. I would also be careful drinking alcohol before bed. So many people drink alcohol at the end of the day to help them relax, but that alcohol robs you of that deep REM sleep, which helps our brain restore itself and consolidate our memories. Another trick to improve your sleep is to take a hot bath or a hot shower before bed. The drop in temperature you experience after getting out of the bath will imitate the natural drop in temperature we experience as we fall asleep. So it will trick your body into relaxing, and it will help you fall asleep faster. Next, it is vital to have the right and timely sunlight exposure. Sunlight helps us regulate our circadian rhythm. So what I would recommend is trying to get at least 10 to 15 minutes of sunlight within 30 minutes of waking up. That natural light will signal your body to start your day more energized, and it will set a timer to help you fall asleep about 15 hours later that day. And probably the most important thing you can do to fix your sleep is try to get at least 30 minutes of exercise, any kind of exercise, every day. Just make sure you don't exercise too late in the day, so no later than 2 to 3 hours before your bedtime. Now, let's talk about a very important blood test that is recommended to be checked in everyone at least once in their lifetime. But it's a test that most doctors don't even know about. And it's called lipoprotein A, or Lp(a), which is a fat and protein molecule that carries cholesterol in the blood. And this molecule can triple your risk of heart attacks or strokes at a very early age. In fact, when we see heart attacks in young people who otherwise do not have any risk factors for heart attacks, like diabetes or smoking or high blood pressure, chances are that person probably has an elevated Lp(a). And it's a genetic condition that runs in families, and it affects about 1 in 5 Americans. So there's a 20% chance that you may have elevated levels of Lp(a). And high levels of Lp(a) accelerates plaque formation, and it promotes blood clots. And it can also cause early aortic stenosis, which is a condition where you get a narrowing of the heart valve that connects the main heart chamber to the rest of the body. And that can eventually lead to heart failure. So that's why it's so important to check the Lp(a) blood test early to see if you're at risk, so you can start intervening earlier before the damage sets in. Now, we currently do not have any medications to treat high levels of Lp(a), but what we can do is to aggressively work on other risk factors to lower your overall risk of heart disease. And the good news is there are several drugs that are currently in development that have been shown to lower Lp(a) levels, and those drugs will probably have their phase 3 trials completed as early as this year. I hope this was helpful, and I'll see you in the next one.